Welcome to the podcast where we explore how technology and human insight are reshaping healthcare. I'm your host, Trupal Patel. Today, I'm thrilled to be joined by Dr. Elise Goodwin, a family medicine physician turned digital health innovator and founder of Physician Heal Thyself. Alisa, thank you for being here. How are you today?
Thank you so much for having me. I'm doing very well. How are you?
I'm doing well, excellent. Thank you so much for asking. So, before we dive into your work, your professional journey, I would love to get to know you a bit more beyond your professional side. What does a typical day look like for you when you are not creating or consulting?
I am a family medicine physician and I was working in private practice, but unfortunately, I was diagnosed with autoimmune disease and I had to take a year-long sabbatical. So I am currently seeing a lot of doctors and spending my time volunteering at one of my friends. He has a family medicine physician clinic here in town. I'm working with him a little bit when he needs
Mm-hmm.
the help. But other than that, a pretty typical day for me is mostly just content creation these days.
Oh, that's amazing. You had such a wonderful journey through both medicine and personal health, right? When you are not wearing the doctor hat, what are the some things or people that keep you grounded?
So I absolutely love spending time outdoors. I think most of us do who work inside of hospitals. And so I'm originally from Montana, and my husband and I live in California, and we just love to hike and to swim and to head out to the ocean, kayak, things like that when we get the chance. And I spend a lot of time with him. My husband and I love swing dancing. And so we really enjoy being able to go dancing for a date night.
Is there any experience early in your life, maybe something outside of medical entirely, right? That shaped how you show up as a both clinically and creator today?
I mean, aside from my experiences with the medical system myself as a patient, which has definitely shaped how I approach both content creation and seeing patients in the office, I think that I really enjoy being an artist, a creator. I do a lot of knitting and crochet and sewing and things like that. I enjoy being creative and I really enjoy kind of more of like a slow living kind of life. I'd really rather spend my day at home baking, gardening, that kind of thing. I'm very down to earth, more rural living, I think, than a lot of other people are.
I'm also rural living and I'm completely agree with you, like doing all kind of work and you look like you are pretty busy apart from your professional life. So good to know. When you look back over the last few years, what's something you are most proud of as a person, not just as a professional?
That is such a
Some-
difficult question to ask a medical provider because most of the things that we do that we are so proud of are all professional.
Right. It just to know more about your personal, maybe something, when you are a kid, right? That, you can share a good story to our listener, our audience.
That is a great question. I have definitely traveled a lot in my life. I have been really proud of that. When I was in my
Uh-huh.
20s, I spent 3 months in China teaching English as a second language. And I've really enjoyed being able to tour. My husband and I like to drive to the national parks, and we really enjoy seeing more of the United States, more of the world. My husband is a dual citizen. He's actually was born in Colombia. His parents were doing aid work in South America. And so we have
Oh,
been
great,
able
great.
to travel to South America. I've actually done some volunteer work in Colombia myself, and it's just been, I guess that's getting back to professional again, but we really enjoy travel. And I think I'm really proud of the times when I've just stretched my boundaries and challenged myself to learn new things and new cultures and things like that.
Great, amazing, amazing. I wanted to ask this question earlier, but I actually forgot this, to ask this question. So where are you joining us from today?
I'm actually currently in South America.
Okay.
My husband's parents retired back to Colombia. And so we are down visiting them at the moment. We've been here for a few months. And so I'm currently in Colombia.
And I've been there for a couple of times at Colombia, and I love the country. I love the people. I can feel that. And you mentioned earlier, Alicia, that now, you founded physical physician, Heal Thyself, right? So what inspired the birth of it? How did those early ideas evolve into what it is today?
Building online content is something that I have been thinking about even as early as medical school. We have so many patients who are looking for information and they are looking online, they're looking for answers, and they're doing their Google searches. And even back before AI, before Gemini and ChatGPT, a lot of my patients would bring in studies or papers or things that they'd read from websites online. And so I knew pretty early on, probably from like my second year of medical school, that eventually I wanted to start a YouTube channel. I really wanted to make information available to patients, and I wanted it to come from a person. I think one of the things when I think about the issues that people are having with the medical community today, one of the things is that doctors seem so impersonal. And when you get
Right?
medical education online, it's coming from big hospital systems. The videos are very clinical, they're animated videos, there's no real people speaking to you. So they don't have a voice of someone that they can say, oh, I know this person's face, I trust this person, they're talking to me like a friend, and we can actually have a conversation about medical issues together. And so that was a really
Right.
big deal for me to try to make medicine more personal and to
Right.
put the information out where people are already looking, which right now is Google, YouTube, Reddit,
I know.
right?
Right.
Gemini is what answers when you put something into a Google search bar now.
Exactly. Is it something you try to fill in some gaps? Like when you first started designing your health tracker, your education tool, your online content, is it a specific gap you were hoping to fill for patients?
Yes, absolutely. So, a physician heal thyself was born really out of two things. The first one
Hmm.
is that every patient really is their own physician. We are here to advise. We are here to say, this is what we know. This is what the data shows. This is when we've studied it. This is what we believe will help you. But at the end of the day, the patients have all of the power in their own lives. They're the ones that actually have to go home and do the work. They have to change their diet. They have to do the physical therapy exercises. They have to take the medicine. Like they have to decide for themselves how they want to live their lives. And in the
Right.
medical community, for such a long time, we have said, just do it because I said so. And I
Hmm.
think we're really coming to a place of recognizing that that's not going to work anymore, that we need to give patients all of the information so that they can make their own decisions. Even if it isn't a decision that we would make, we really need to allow them the ability to do that. So when I was looking at starting a channel, I was asking myself, what can I do to give patients more power? How can I
Right.
give them more information, more tools that will actually help them? And I started with medical history tracking and symptom tracking because that was two things that I was constantly Googling as a physician, looking for resources for my patients while I was in the exam room. I would sit there and my patient would say, I'm having all these migraines. And I would say, I really need you to track them for me so that I can figure out what kind they are and whether or not your medicine is working. And they would say, I don't know how to do that. And then I would look online and say, is there a resource that I can give you? And there never was. And so finally, I just built it. I really wanted to have something where I could say, okay, I need you to track these symptoms. Here's the worksheet to do it. Take that, bring it back to me next month, and we'll see where you're at. Because that's the number one thing is for really non-specific symptoms like gut symptoms, fatigue, mood. There are things that I can't really figure out in 15 minutes unless I have a timeline, a very specific record of what's been going on. And with medical history tracking, a lot of people don't know that in the United States, the systems don't talk to each other, right? If you get
Right.
service at one hospital and then you go to a private practice clinic and then you see a specialist at a different private practice clinic, none of them have access to any of each other's records,
Right.
especially if you move states or you leave a large organization like Kaiser. Then
Hmm.
you go to a completely different system. We have the hardest time getting any records from a big hospital like that. And so if
Right.
patients don't have copies, let's say that they had years of a chronic autoimmune disease and they come to see me and
Uh,
they say, here's my medicine, I have to start over, basically. I don't know what they've already tried. I don't know, maybe they had a flare 8 years ago and the only thing that worked was this one thing. And we just don't have that information. So I beg my patients to please keep track of their records. That was the other thing that I built first was a medical history tracking workbook, and they are available for free downloads on my website, but I do actually also have them on Amazon. So I actually published them, which was a
Right,
journey learning how to do self-publishing so that patients
right.
could actually just get a printed workbook that they could fill out and go through. And it's set up so that it makes sense for them. The questions are like what you need to know, but then it's also in the order that it goes in our electronic medical record system. So you can just hand it to your doctor and they can just go down the list. That was the hope and the dream, was to make things easier for people.
As a patient, I feel like, this is much easier than, what used to be. And one thing I want to tell you that I'm with Kaiser Permanent for almost now 9 years. So I
Mhm.
know how it works. And if you go out of your Kaiser career, then it would be an issue. But I see what you're saying.
I apologize to my patients when they come to me from Kaiser. I say, you have been getting five-star treatment.
Right, right. Means when I usually travel outside of my area, like DMV area, I'm based off of Washington, D.C., and I travel outside of, that area where I don't see any Kaiser. Nowadays, they put, I think, some tie-up with Cigna, but still, it's not that seamlessly integrated as within that Kaiser permanent network. So I
Mhm.
see where exactly the gap is. When patients come in quoting what they saw online, what do you think that tells us about where the system is still it's not meeting them?
I think the main issue, and we've all known this for a long time, is just that office visits are 15 to 20 minutes. We don't have
Right?
the time to answer all their questions, to truly counsel them on the
Hmm.
medication or the medical condition that they have. I oftentimes, for like a new diabetes diagnosis, have to bring patients back 3 or 4 times before we can cover everything. And we have handouts, of course, that we give patients, but they're going to get curious. They're going to have questions at 10 p.m. They're going to forget that they wanted to ask me, and they're going to go online and they're going to look for answers because that's where most of our information is stored today, is just on the internet. And some of it is
Right.
fantastic and some of it is not. And I think what we need to focus on as a medical community, rather than saying you have to come to me for all of your information, I think we need to focus on teaching people how to find good information and then how
Hmm.
to tell. Like if you see a random video on TikTok or on YouTube Shorts, how can you look it up? How can you double check it? How can you tell whether or not it's telling you the truth? I think we need to move into just assisting and allowing patients to go ahead and do that. And that's been a really big part of my practice that I don't know
Hmm.
that every physician does, is that I ask my patients to bring me studies. I'm like, hey, look, if you find something online and you want to talk about it, bring it in, bring it to me. If it's a study, if it's a website, if it's a random video, I will sit here and watch it with you and we can talk about it. Like that is not a big deal. The reason why most physicians don't do that is because we don't get paid for it. You only get paid for the service that you're
What
providing to the patient. And
exactly?
so it takes up a lot of your time. It kind of puts your schedule behind, but I think it's important. It was a really big value for me.
Right. I noticed along that line, like some of the physician, even if I refer from my physician to another physician or some specialist doctor, I always first check review. And then if I have some issues, first I do like a chat GPT or, Gemini to check, okay, what are the things I need to care about or what are the things as a next step I need to do? But always physician or the human touch required, right? Sometimes physician accept whatever I came up with as a research, as all my analysis, around that pain points, right?
I'm seeing both sides. I have had patients come in and say, I am having right upper quadrant pain, and it's only after I eat, in and out. And I
Right,
looked it up on ChatGPT, and I think I have gallstones, and they're completely right. And then I
right,
have had the patient who put their labs into ChatGPT, and their AST, which is a liver enzyme, was slightly elevated. And ChatGPT told them they had liver failure. And they called my office screaming, you didn't tell me, you missed it, that I had liver failure and I'm dying. Well, no, they were actually just a little dehydrated. Right. So sometimes it's giving fantastic answers, and sometimes it's giving answers that are really scaring patients.
right. And I totally agree with that. So, in terms of challenges and opportunities, when you advise startups on integrating patient education tools, right? Where do you see them getting stuck the most?
Absolutely. I've only done a few. I'm still very
Hmm.
new to the business consulting world, but I think there are two main hangups that I'm seeing the most often. And the first one is the database that you're going to be getting that information from. A lot of these big hospital systems have their own patient databases where you can like put in the search bar or pull up on right upper quadrant pain or gallstones, print that out, hand it to the patient. Startup companies don't necessarily have access to those databases. You can sometimes pay for access to those databases or you can build your own, but that's incredibly intensive. And then you have to ask yourself, where is that information coming from? Is it pulling from PubMed? Is it pulling from journals like the New England
Right.
Journal of Medicine or something like that? Is it pulling from Mayo Clinic's articles? That's actually a really
Hmm.
common place because they're all
Right.
open and available online. It's a very trusted resource. They're already geared towards patient language. Or are you trying to pull from something like Up to Date, which is a physician resource? And so the language is very different. So that's probably the first one. And then the second is user interface. Patients
Right.
really need things to be very clear, very specific, and easy to access. And I think that getting the software so that it makes sense to the patients, not necessarily the company or the medical providers, is really can be hard to do.
One of the key things that you just mentioned, it should be user friendly, right? Because patient you have like from younger to elderly, right? So they know if they are interacting with some system or a tool, it should be very user friendly. So that is the one of the key thing I can take as a challenges. Are there any moments where you wish the tech could just take something off of your plate so you could focus more on the human side?
Absolutely. I am so, so happy with the scribing AIs that are coming out and the billing AIs that they are hopefully starting to use. We know, or at least providers, physicians know that the insurance companies change the rules every year. Every January, they change something. Like the year
Right.
before, one specific code will cover headaches. The next year, it doesn't. Right? You have to use a different code. And when the ICD-10 came out, they dramatically increased the amount of codes and they dramatically increased our paperwork and our billing on the back end. And
Hmm.
any AI that can take my notes and then another AI or even the same AI that can actually read through my note and properly code it and bill it is going to be one of the most amazing things that anyone ever comes up with. If I can just go back to basic care and
Right.
ignore the rest of the back end, I think that would be absolutely fabulous. And I have noticed that it has dramatically improved my patient care. Because when you
Right.
are dealing with an AI scribe, I have worked both with virtual scribes, in person scribes, and AI scribes. And
Hmm.
in virtual scribes, kind of need you to say a little bit of context, right? Like you'll speak the physical exam aloud, but most
Right.
of the visit, they can kind of tell just from what you're talking about. In-person scribes obviously don't even need you to narrate the physical exam. But an AI scribe really needs you to clearly state back to the patient what they told you,
Hmm.
what your physical exam findings were, what your
Right.
diagnosis is, and what you want to do about it, which is much better patient care. So I have noticed that sometimes I was getting sloppy and I wasn't necessarily saying everything very clearly to the patient. And then the AI, of course, doesn't pick it up and I have to type it in. So I think it's actually helped me quite a bit be a lot more clear.
That free up a lot of time of yours, so that way you can more focus on your the actual diagnosis, right? Like, actual work. So yeah,
Yeah.
and this is another great question I usually ask to my wife, say like, if you had a magic wand to fix one bottleneck between great education and real world behavior change, what would you start with?
Fix one education problem, it would definitely be removing misinformation from the internet. If I could just wave a magic wand and it was all gone. That's what I would want to do. I think there are so many things that get involved in along the way. There's so many
Hmm.
system issues that we have that really prevent patients from being able to make change. And I honestly don't think education is a huge part of that. People know what they need to do. It's
Right.
really a matter of helping them actually find the practical way to do it for their specific life. And that's
Hmm.
actually one of the things that I do like a lot about AI. I think AI does an absolutely fantastic job as a personal life coach. If
Hmm.
you give it, here's what I'm supposed to do, here's the doctor's recommendations, here's what my life actually practically looks like, it's fantastic at helping you come up with ideas for how you can actually change your specific situation.
Right. I totally agree with that. So looking ahead, in terms of vision, right? When you picture a physician Heal Thyself a year from now, what kind of impact would you say like, yes, this is working. This is the way it should work.
Yeah, that's a great question too. I think that right now I'm in the process of recording the complicated and long counseling stuff that I do in the office for patients. I want to make it available to everyone online. So I started with depression, which is something that many, many people struggle with, especially within the last few years. We've seen a dramatic increase in depression and anxiety and insomnia. There's some really big issues that are really hitting our entire culture. I started with depression because it's the one that takes the longest to get through in the office. And I oftentimes don't actually give patients all the counseling I want to give them. And so I wanted to
Hmm.
make it available online. I've been doing it as a YouTube series, and then I also have a video course available on my website that it's 46 videos long. I mean, it's over 6 hours of content that
Wow.
covers everything. And a year from now, I hope to have several more. I really hope to do anxiety, insomnia, ADHD, things that people have a lot of questions about, and just say,
Hmm.
hey, in the last 10 years, over all of these thousands of encounters that I've had with hundreds of patients with these issues, here's all the counseling that I have ever done. So you can just watch it. And if it's something that helps you, fantastic. That's what I really want is patients to be able to say, I watched this. I was actually able to take this information and change my life and get out of this hole that I've been struggling with. That would really be amazing. That would really be the dream.
Right. Hope that that works. So, and the next question around the same, like, how will you know that patients are truly being empowered? Are there any signals or results that you hope to see more of?
I think it's going to be a matter of patients just telling you.
Hmm.
You had this on YouTube, and I was able to go and talk to my doctor because some of my YouTube videos are things like if you feel like your doctor is ignoring you, or if you feel like your doctor isn't hearing you, you've told him about your symptoms multiple times. Like, here's some phrases you can use, here's some words you can say, here's the PDF tool that you can use to show them what's going on and say, hey, I don't, and here's when maybe you should get a second opinion, or ask for a referral to a specialty clinic. What I hope is that patients can come back and say, I used this and it made a difference. It really helped me. Other than that, I mean, I am a very small drop in a very large bucket, right? There's a lot of really
Right,
amazing
right.
physicians online already. I
Hmm.
absolutely love Dr. Mike. He does just a fantastic job. And
Hmm.
I think that, his comments are full of people who come back and say, hey, I used this in my
Right.
life and it made a difference. That's how you're going to tell.
I absolutely, means I have a great hope that we will touch that point soon. So great. If you could design ideal collaboration between physician, patients, technology, what would be that ecosystem look like? Is something like one of the key point we touch, first of all, the user friendly, right? The seamless integration, right? That is another challenge we saw. So along those examples, what would that ecosystem look like when we try to integrate all those three pillars, right? Physician, patient, and technology.
Yeah, that is a great question because where I would love to go, I don't know if that's where I think we're going to go as a country. I think the dream would be that all patients would be seen in multi-specialty clinics. That's been something I've
Hmm.
been thinking about for a really long time. When you go to see your family medicine physician, you should really be seeing your family medicine physician, your dietitian, your therapist, and a physical therapist in the same day. We should just back to back them all in the same building. If you need to see your cardiologist and your neurologist, you should also see your family doctor and maybe the social worker all on the same day. And we have amazing pilot clinics that have come out of some really big hospital systems like UCSF and Stanford who are doing
Right.
things like that. And it is working so well for patients. I would really love to see that broaden across the United States. It's difficult in rural areas, of course, obviously. But if we were able to build systems where we had this collaborative group of people working together to help these patients, and we were able to get everyone on one system, or maybe 5 or 6 systems that all talk to each other,
Right.
I
Amazing.
think, yes, it would just be the dream if we had an app
Right,
that the patients could just log throughout the day or throughout the week what's going on in their life, their blood sugars, their blood pressures, and it automatically
right,
uploaded into our charts. And we could automatically send it to the specialist, or we could automatically have it reviewed by the nurse and the family doctor and maybe the endocrinologist, right? If they have one,
right,
that we could actually start to see fewer mistakes, fewer misdiagnoses, fewer, less miscommunication, and a whole lot more patient satisfaction, a whole lot more patient engagement. And I think we could see major change, because the question we have to ask ourselves is our current healthcare system truly set up to help
hmm
patients change their lives? And the answer is
right,
no, of course not. Our culture isn't really set up for that. Our culture is set up for people to go out to eat and have a drink, and we drive in cars, and we sit at work, and we sit at home on the couch, and we watch Netflix. Like, our culture does not have the values that necessarily lead us to health. And so when we're
I
looking
agree.
at changing that, it's a bigger question, it's a bigger issue that
Right,
having, an AI integrated app isn't necessarily going to solve. But having an AI integrated app where patients could ask questions and we could maybe review the answers is an absolutely amazing start. Like, it would get us moving in the right direction.
right. And this is a really good insight that you just mentioned. And this is something we talked about, the future, the dream of, that health tool or the patient engagement tool. Let me ask this question to you, Elisa. One digital health tool you secretly admire.
Oh, that's a great question. There is an app allows patients to keep track of their own health and record their own medical health, and it automatically integrates with a lot of medical record systems.
Wow, that's amazing. That sounds amazing.
I really like tracking tools. Like, I really like patients that can get the continuous glucometer. That has just been a game changer for so many of my patients with diabetes. And
Hmm.
I'm tentatively liking the Aura Ring, where you can kind of track your stats. It works a little bit better. The Ring is working a little bit better than the Apple Watch or the Fitbit in terms of like heart rate and sleep tracking and things like that. So kind of waiting a little bit on the data, because what ends up happening is if you track too many things too often, it just makes people
Right,
anxious. They just come in
right,
and they're just like, I didn't sleep for a week and I don't know what to do about it, right? Like, my app is telling me
right.
that I'm not sleeping.
Huh?
And most of the time, the issue is just that, they're moving their wrist too much. And it's not that they're not sleeping, because the way that a Fitbit tracks, it doesn't actually track, changes in temperature or changes in heart rate necessarily for sleep. It's just tracking wrist movement. And so I really like tools that give patients agency and power, but don't necessarily add anxiety. That's what I'm looking for.
Right. That sounds amazing as well. And we wish that, we could use, in those kind of tools, more AI-driven tools in near future. Has been such an insightful conversation. I love how you are reframing patient education as a partnership, not a prescription. So that is I like that perspective from the way you started your journey, the online tool, online education. It's not as a prescription. So for everyone who wants to follow your work, right, who got to know more about your journey or your resource or your educational videos, where is the best place for them to connect with you? Is it any platform, any YouTube link, LinkedIn profile, anything that you could share with our listener, our audience, so would
Yeah,
be helpful?
absolutely. My website is drgoodwinmd.com, and I am
Okay.
on YouTube and LinkedIn and Facebook and Instagram and TikTok and Twitter as Alyssa Goodwin MD.
Oh, cool. And I'm gonna follow you after this call for sure. So
Oh, thank you.
yes, yes. Few things along those lines that you just mentioned. Probably I would love to interact with you more, or I follow more of yours, a content, YouTube content or online educations. And maybe something we can explore together. Melissa, thank you so much for joining us today on Voices of Advanced Care, and for reminding us that empowered patients can reshape the future of healthcare. So thank you so much. I really appreciate it for your time and your insightful detail, amazing conversation, what we had just now. Thank you so
Fantastic. Thank
much.
you so much. Thank you for having me. I really enjoyed it.
We are going to sign off. Thank you.
Thank you. Have a great day.
You too. Bye bye.